birthday. I'm Dr. Roney. I'm here with Dr. Gama, Dr. Maggie Gama.
Hi, everyone.
Welcome.
Thank you.
All right. Great to have her here, right? Huge resource, knowledgeable resource. So for the Q&A, it's going to be a good night getting these questions answered. So I wanted to make sure we introduce Dr. Gama. When we pull up the slides, I'm going to let you do a little bit of CV review,
Okay.
right? And just let everybody know,
Okay.
what's what. But very good resource here. So we're happy to have Dr. Gama. You've been here a couple months now, right?
Yeah.
I think. I mean,
2
time
months,
flies,
yeah,
but
2 months.
but yeah, I mean, she'll go through her background, but it's one of the people that I would want in my corner, and I mean that wholeheartedly. So anyway, we'll get to that. Okay, so I want to go over with all of you, welcome, right? If you're new to the Cancer Conversation, I want to take the opportunity to welcome you. If you've been here before, welcome back. We appreciate you joining. We're really trying to, we talk about this all the time. This is really a movement, right?
Mm-hmm. Yeah.
And the movement is to give you all information that you might not otherwise be getting going down this road of cancer, either prevention or cancer care. So
Or aftercare, for that matter.
that's exactly right. Aftercare, preventing reoccurrence from coming back. It should be, and I think you would agree, it should be mainstream in 2024, right?
It should be, yeah.
It should be. That's a whole other topic of conversation that we can get to some other day. It's not. So what we try to do with the Cancer Conversation is be able to just teach and show you and let you in on, the things that are going to help you the most, and really to give you the most upside. Right? Because again, when we're looking at the big picture, and I'll get into the 4 pillars, right? And I'll do that right now. I'll go right into it. The first pillar in our 4-pillar approach is all about the testing, right? So we want to make sure we're looking at as much data as possible in addition to, right? Not instead of, but in addition to what they might be testing in the conventional model. So blood work, labs, your scans, ultrasounds, MRIs, CAT scans, PET scans, of course. Right, of course. We also will get into more data points. I think the patient that we were talking about today, sarcoma patient, for example, right? I think this is a really good example of how to use the data to our advantage that may not otherwise be used in the conventional model. So we have a sarcoma patient, right? It's a kind of a rare cancer that doesn't respond that well to conventional treatments, right? Or
like
treatments.
Chemotherapy, yeah.
Yeah, treatments in general. So when I talked to Dr. Gama, Dr. Keneally, they talked about utilizing a test called Fulgent test. The Fulgent test, among other things that it can do, is look at markers for immunotherapy response, correct? PDL is one of those, PDL1 is one of those, HER2, right, is another. So in order to dial in the care for this patient, we need that test to see if...
I think the important thing is, we don't want to overstep boundaries with oncologists, but sometimes depending on where you're getting care, it's not always done, the molecular targets. And that's kind of where a lot of therapies are right now. So we've had some patients come here that we found targets for and sent them to an immunotherapy oncologist, and they got treatment and they're doing really well. So it's just finding all of everything that cancer might be, we could use different targets to attack and kill that cell and kill the cells and not have it come back.
And otherwise we wouldn't know.
We would know, right? Yeah. So we use a lot of different labs, specialty labs, not like your regular labs that the regular oncologists use, but as Dr. Roney was saying, kind of delving deeper into genes, the methylation detox genes. That's a really big one. I really believe in understanding that for every patient, because it does matter. If you have those genes, and how you respond to medications, how toxic you are, assessing your gut microbiome, like we mentioned before, is important. Finding out if you have any underlying infections, and I think you'll address that.
Yeah.
So you can go ahead.
The cause-wise, and going back to the testing for this particular patient, right? So the Fulgent test for immunotherapies, there's other things that test shows. But then the other one, the DATAR test, and if I'm not mistaken, it's the Exacta, right? Which can it will give you repurposed medications that you might be sensitive to. It could give you chemo sensitivity, right? It can give you natural agents that you're sensitive to. So think about this. If we have a patient that they say, hey, some of these conventional approaches may not work well, we want to be precise and dial it in as much as we can and individualize it to give the patient the best chance. So if you, just hypothetically, if we're working both of those tests for this patient, we are able to figure out if there's immunotherapies, chemo agents that these cancer cells are most sensitive to without guessing. Because we talked a little bit about this. If they start a chemo, say conventionally there's a chemo regimen that is standard of care.
Right.
And they start it and it doesn't work, there's chemosensitivity, right? There's something that happens with the body that reduces its ability for other things to work. Isn't that correct?
Or it just doesn't work from the beginning.
From the beginning.
It's not sensitive to it.
Right.
In the beginning. So the TAR will help. That's one of the tests we use. Will help figure that out for your specific type of cancer.
Right.
Not just for general, like, let's just say breast cancers, for example. Like if it's ER/PR positive, we have tried and true like recipes that oncologists use for different treatment regimens, and this would maybe give more information regarding which ones are very pertinent to your type of cancer.
Yeah. So those specialty tests. Personally, as I'm looking through it, in case anything happened to me, family, whatever, they're absolutely 100% on the list of things that I personally would do. You as well, right?
Yeah, I would do it too, for sure.
You dial it in much better. So that's part of what I feel really good about, that we're doing more and more of as we're learning. And again, just dialing it in better. And then there are other tests that we could do. Obviously the markers, like breast markers, 15-3, 27-29, the CEAs, the LDH. There's a long list of those, by the way, ladies and gentlemen. And then you can get into nagalase and PHI and D-dimers and some other kind of specialty labs that could be done. And the way I look at it, that can paint a very broad picture. So if we have a blank canvas, we start doing 6, 7, 8, 9, 10 different markers. We typically are dialed in.
Yeah, we
right,
can find a lot of information out. Yeah,
that's
for surveillance and treatment.
That a great point, because it's not just for today, but what about, okay, we get to no evidence of disease, and then we have all these different markers, because as I understand it, and I think you'll attest to this, a scan is great, but there's change in the tissue before the scan shows up positive a lot of times. Correct.
Yeah, and it's it doesn't detect it when it's just just minute recurrence. It's not going to detect it. So there's other ways that we can use to pick up like early recurrence too.
And all these data points that we talked about are part of that surveillance. Right. Right.
And that's so important. I think I guess I would say that a lot of times when you're done with treatment, you just kind of go home and there's like, okay, now what do I do?
Yeah.
And the aftercare, the surveillance part is really important, because you want to make sure that if it is coming back, then you can come and do something about it. Get vitamin C or curcumin or a lot of the other IV protocols and treatments that we have here, and you want to act on that quickly and not wait till it shows up on a PET scan.
Yeah, and that is, I love the point, because when people come here right after and they say, hey, the doctor said, hey, go, we'll see you in 6 months, 12 months, you're good to go, eat whatever you want, do whatever you want.
Right.
For me mentally, that's a hope and a pray.
Right.
Hope and a prayer.
That's a good way to see
right?
it. Yeah.
If I would rather have a plan, and again, this is just personally, but we see it work every day, so you get more and more convicted in a plan like that. And a plan that gives you way more predictability and less chance.
Right.
Isn't that what a plan does?
Plus, and you feel better too, because you know that somebody's watching you.
Yeah.
And I think that gives a lot of peace of mind as well, for sure.
Agreed. So that's pillar one, right? It's that testing. Now, there's cause testing too, which I'll get into. But for the cancer part, a lot of those things that we've just mentioned are our first line of, what we call our pillar one. Pillar two, I'll mention it briefly, is starving the cancer and killing the cancer. So starving would be your repurposed medication. If you're familiar with the metabolic approach, right? It's using things like metformin and sometimes your antiparasitic drugs, even statin medication or antibiotics could be used. And that's what some of the testing that we just talked about can dial those in.
Yeah,
based
like
on your
Tatar.
cancer.
So like that testing, for instance, will let us know if things like doxy or simvastatin would, if your cancer is going to be sensitive to that. And all of the repurposed drugs have targets too, molecular targets as well, and that's why we use them not just for what they're useful for. Like doxy, we don't really use as an antibiotic; it's used for other molecular targets for cancer.
Yeah, and so starving, right? We're using those medications, and starving might be just a broad term, but it gives you an idea of what we're trying to accomplish. We're trying to basically slow down the cancer itself by stopping the feeding of it, if you will, right? And then you get into your ketogenic diet. So we know that cancer cells use glucose and glutamine. So if we have less glucose and we can pulse the glutamine or kind of slow that down a little bit, plus use these medications, quote unquote, starving the cancer. Right? And slowing it. And if we slow it, then some of these treatments that we're about to talk about can get ahead of it. That's part of the idea, right?
Yeah.
It's a full sometimes it just needs everything. And so we're going to hit it with as many things as we can. And then when you talk about the kill phase conventionally, or even here, could be chemo, surgery, radiation, immunotherapies. It could be low-dose chemo, which is a really good, a very effective methodology with low negative side effects, right? Overall. Yeah, very little. Intratumoral immunotherapy. There's a lot of different things that could be done in that kill phase. When we're talking about more natural killers, right? We're talking about high dose vitamin C, we talk about hyperthermia, we talk about a mix of different IVs that are shown to have a cytotoxic effect. So we could combine sometimes the bomb and what I call cannonballs and grenades to make a really strong, concoction, if you will, to help kill the cancer cells. And then also, while you're going through that, this is, I think, a critical element too. Our pillar 3 is really protecting the cell, right? We know there's hallmarks. There's a weakened immune system. So right out of the gate, when anybody comes here, one of the first things we want to do is strengthen their immune system, right?
That's
of course, test it, but we certainly want to strengthen the immune system. We want oxygen at the cellular level, right? We want the cells alkalized. We want to charge the cell based on Dr. Tennant's work. We want to look inside the cell to see what the nutrition level looks like, your trace minerals, your vitamins, right? They're all critical to that process.
Yeah, and that's a good point, because I think a lot of times conventionally people don't do well with treatment because they kind of start with all of that deficient that you just mentioned. Minerals deficient, antioxidants deficient. So there's not a lot of reserve to start with. And then we do things to kind of make your body more toxic, and it's difficult to kind of rebound from that. So I think that's an important part, is getting all that side of it a lot better while we're giving you treatment. Or even like for aftercare, as we mentioned, like that's the other kind of thing that we do. The other arm that we do is bump up all of that you mentioned. Yeah.
It's really, if we look at the effect of the oxidative stress or the inflammation, if you will, or the damage, is the cell just the mitochondria gets affected, the DNA and the genomes are affected. So as those things become affected, then mutation is more, right? Those those cells will mutate more.
It's just harder to
more.
repair.
That's
DNA
exactly
is harder
right.
to repair.
Yep.
So we just want to give it all the chance that it can have to do that repair and not mutate.
Agree. And coming out of the gate, right? So with somebody day one, these are the things that we're going to do without having a lot of data yet, because they're hallmarks. They're things that are known of what's going on in the cells. So we want to reverse that as much as possible. And then pillar 4 is addressing the causes, right? You get into bacteria loads, you get into viral loads, pathogens like the fungi, right? Your candida, your mycotoxins, your parasites, heavy metals, non-metal toxins. I mean, mold, all those things.
Lyme disease, all of that.
Yes, bacteria like Lyme. Yeah, it's a great point. All these different things we have to start looking for. And because if there's enough of those gasolines being poured on the fire, at the cellular level, these things really attack the cells, right? Or get either trapped in the cells, get attacked, or changing the DNA, changing the mitochondria, all that. And so working from the cell out is one step, and then clearing out the gasolines to the fire is step two. And I know I agree with you 100% on this one. The methylation process is significant out of the gate to understand, to be able to draw up a treatment plan that's going to be much more beneficial had we not do that.
Absolutely.
Right? And that I think we're going to do, I would love to do maybe a upcoming cancer conversation with you on that.
I do think that's a big missing link for sure.
Yeah.
Is understanding that part of it.
I agree.
So I think that would be good.
There's a great book out there called Dirty Genes, right? It's Ben Lynch, yeah. And he does a good job of explaining some of the main, what they call SNPs, right? These mutations that basically start to express, and that's epigenetics, and the whole process of that. But it goes down, a pretty good road of just understanding, and that's a good reference for you if you want to learn a little bit more. What he talks about, and I agree 100%, is we're all born with mutations, probably millions of them, right? But nowadays, all this stuff that creates chronic disease, whether it's stress or toxins or chemicals or infections, there's more of it today, arguably, right? Yeah. Which means those are turning on these mutations more and more, and we're creating more and more expression. So I think because of that, I think it's the relevancy of testing it more and more today, especially right out of the gate.
For sure. And I think it just really leads to more personalized medicine too. So if you understand the SNPs, and they're also called, they're known as single nucleotide polymorphisms. So they're like, if you were to do a 23andMe, you would have probably pages of them, and then to get someone to interpret that for you. So even things like, certain medications, do you have a SNP in like kind of utilizing that medication or metabolizing it? So it's very personalized, and that's what we don't have in regular conventional care, is the personalization of all that. And we try to do that as much as possible here. Yeah,
and when we do the cancer conversation on methylation, because Dr. Gama reviewed it in our meeting, our weekly meeting, and it was fantastic. But when you listen to it, you're like, oh my gosh, we have to know this information to be able to treat properly. And you realize quickly that there's just, I hate to say, a lot of guesswork out there, right? Or what they think, okay, it says this works well, that works well, but not really, not all the time.
Right.
It's kind of standard operating procedure, but then you can get into the nitty gritty with the methylation
because there's probably some chemo agents that you don't want to take that have to do with folic acid, folinic acid. So that will help us kind of delineate that as well.
Yeah, and you made a great point, chemo agents, right? So if somebody doesn't do well with chemo versus, say, people that do, the downside is it's usually because there's a methylation issue.
Yeah.
And you're not able to clear them properly.
Right.
So they build up.
Toxic.
And the methylation panel can tell us that. And we can help work through that before we start chemo maybe.
Right. We can do more detoxing sometimes we have to do a little bit more gentle detoxing in the beginning, but in having that information will help guide you to detoxing appropriately.
Yeah, and I just a brief mention, because I even had a family member go through this where the chemo, people are very afraid of chemo when they see it really be devastating to the person.
Right.
A lot of times it's very devastating to one person and not another, with the way they detox, with the way they're methylating. Yeah. So it's a big factor. So we will get to that on a upcoming cancer conversation. Okay, I want to mention this briefly. This is the prevention protocol, right? So you've heard me say it a million times, 2024, we really want to work on sharing the preventative part of this. It's way easier than the cure, right? Prevention is always easier than the cure. So even for me, you hear me tell the story that worked out for the last 30, 40 years, supplements, food, all of it, like seemingly pretty healthy. But now we have patients come in that I feel like are just like me, that have done the right things and still develop cancer. And you just scratch your head like, what the heck? Yeah. Well, that's where getting deeper dive into bacteria loads and viral loads and pathogens and whether it's candida or parasites or heavy metals.
Stress.
It's stress, big time. It's a huge factor today that we should be taking a deeper dive on the wellness side, right? If we want to create cellular health and those cells repairing and replicating faster than they're breaking down, there's a lot that needs to be done these days in order to have that happen.
Yeah, to stay healthy is a lot more than what we used to do or think of in the past, I think.
Great point. And that's the point I was making. I now know, oh my gosh, I have to do, so if you look at some of the personalized prevention plans that we put them together kind of mimicking what we would do with a cancer patient, right?
Yeah.
Because the cure and the treatment actually aren't that dissimilar.
No, you're right.
Right,
Yeah.
as far as cellular health and
yeah.
causes, they're not that dissimilar. The only thing that's dissimilar is starving and killing, but everything else that we talked about is how you prevent it as well.
True.
You do these tests, you clean things up before they become a problem.
Right.
So that just gives you an idea.
Because all of these chronic infections will eventually lead to some problem.
That's right. That's the oxidative stress and the damage to the cell. So so I wanted to just mention that. The slide here, I put it up here, I left it up here for a while. So it gives you an idea. At the end, I'll give you some numbers to call if you were interested in doing so. But even just learning some of this and doing it somewhere else, like that's great too, right? We do a great job because we have a lot of things under one roof, but really this is just sharing, again, information so you could share with people outside of the state or wherever, and everybody can get healthy. So, okay, so we went over the cancer prevention and care, the comprehensive testing, and the 4 pillars, basically. Okay, that's the plan. There's a lot more detail to it, but for time purposes, we'll kind of move on here. All right. So first question: HRT supplementation after breast cancer. Can we use it if we could find a prescriber, and how risky is it?
So that has a lot to do with what kind of breast cancer you have. In other words, is it estrogen receptor, progesterone receptor positive? I would say that if you're ER, PR positive, that means that you have the receptors for estrogen and or progesterone on the cancer cell, and that's feeding your cancer. So my approach to that first would be to do a methylation detox test on you, what Dr. Roney had mentioned earlier, to see if you have the methylation genes, because in my opinion, a lot of times that is one of the causes for breast cancer, is that there's methylation genes, and then you kind of have become estrogen dominant, and nobody really knows why you're estrogen dominant. So we don't want to give you, if they're blocking that estrogen receptor with estrogen blockers and you're now in remission, we don't want to go back and give you estrogen again. So I just personally, I don't do it because I don't think it's safe to give that. Now, if you're ER, PR negative, that's a different story, because that's not, in a sense, feeding that cancer. But I still would want to do a methylation detox profile, and I would want to do another test by Genova called HUMAP that will test your female hormones, what levels they're at, and how those estrogens are breaking down, if they're breaking down into good metabolites the way they should, or if they're breaking down into metabolites that could be causing cancer.
Those are the hydroxyestrogens, the 2, 4, right? Yeah,
right.
Yeah,
And,
great test.
Yeah, and those are usually, if you have like COMT gene that's in the methylation pathway, the COMT genes help break that down, so that's why that's important. So, some people, like prescribers, I've seen people that have had breast cancer and they get prescribed estrogens or progesterones, but I honestly, I just wouldn't do it. Now, if you have like things like vaginal dryness, there's other ways to kind of go around that by using estriol, which is E3. It's a more protective sort of estrogen, and you could do have somebody prescribe you like a suppository for dryness. But I wouldn't do it to balance hormones. I wouldn't give you estradiol, for instance. But estriol would definitely be a consideration. And also progesterone too. Progesterone in small amounts would be possibly okay to give too, if you're out for a while.
Yeah, and to Dr. Gama's point, it's not really just a straightforward answer.
Right.
There's data collection that would be done prior to then figure out exactly, again, this is the individualized, I think it's the theme of tonight, is there's a lot of individualized testing that would be done as opposed to saying, oh yeah, it's a good idea.
Right.
There's data that's
exactly.
needed to be able for the provider to be able to give you a safe, because you were bringing it up earlier, the COMT gene, your estrogen just could be backing up, right? And not clearing, which again could be a major factor in your cancer.
Right.
It's really a good thing to know, because then you could address that and start clearing the estrogens out too.
Exactly.
Right. So
That's exactly
it's definitely, so to that point, a lot of data collection before that answer probably would be given as a general, right? More specific. Hopefully that helped.
Yeah, and a lot of times I just say, like, even like non-cancer patients, they'll, like, if they're estrogen dominant by labs, like just conventionally, then a lot of times they'll give progesterone to balance the estrogen. But that's not the problem. The problem is that why is your estrogen too high? So you don't want to give more. You want to figure out why it's like that, and then fix that first. Because you can, provoke a cancer, if you will, if the estrogens are chronically high, and then you just give more hormone on top of that. So that would be like a preventative measure.
Yeah, and like you said, it could be the gene mutation, it could be the COMTs, it could be maybe you need, and with those, maybe you need some DIM. Maybe you need some indo-3-carbinol or calcium deglucarate, so you can help because xenoestrogens are a big thing, but then we're exposed, I don't know, that gets into a topic of, we're all kind of exposed similarly, I think, personally, and then it comes down to, well, why do you have a higher level than maybe the person next to you in the same environment? Comes down to methylation and the liver's ability to detox.
I mean, I think there's other factors too, like, for women, like how old were you when you started birth control pills, for instance, and do you have these genes that just cause you to build up over the years? And then all of the xenoestrogens, like you on top of that. So there's kind of like compounding factors.
Which is why you want to look at pretty much everything, right? Yeah, good answer there. All right, Protandim, they have claims helping cancer among other health benefits. Do you feel it's safe with the milk thistle amount for someone with already high estrogen, or is there a risk of feeding estrogen positive cancers?
So I do like Protandim. There's, I think it's like Nerf 1 and Nerf 2 Synergizer. I think that's what it's called. But I have seen it has Bacopa in it. It does have some milk thistle. I think that it's really good for oxidative stress for cells. The Nerf 1, Nerf 2. I've seen it really helpful for plasma cell dyscrasias, plasma cell myeloma, and also for some other tumors like breast and prostate. So I don't think that as far as like the estrogens being high, that needs to be monitored. So having a good, just as we mentioned before, having a good screening test before a salivary or urine test for hormones, not blood. I think that would be good if we wanted to know, like, would this be a good supplement for you? That's what I would be doing. And if your estrogen was high, then maybe I don't think the milk thistle, if that's what you're worried about, is high enough to kind of like invoke like more breast cancer. I don't think that would be harmful, but just knowing where your baseline is important. Yeah,
and using something like Protandim, if you think about what we went over with the 4 pillars, it's one piece of it's one thing, right? Of many, right?
Yeah.
It's not an end all be all. I know I have a lot of patients that come in and said, hey, I read about methylene blue, or I read about Protandim, or I read about whatever, and we're in synergy with this one. They're good, but sometimes there's promotion out there of this can cure your cancer.
Yeah.
And it really doesn't work that way.
It's not just one thing.
Yeah, exactly. And that's the point I wanted to make. Right. So this could be used in conjunction, but the way they tout some of these things in the literature, and it's really, in my opinion, a little salesy, because they get you to believe like, oh my God, this person cured their cancer with this one thing. Now, I'm not saying it can't be done, right? But I'm saying it's probably the major exception and not the rule.
Right.
Fair?
Yeah.
I just wanted to kind of
But I do like
that
supplement.
Oh, for sure. Yeah, me too. No, I'm a big fan of one of many. All right. What type of scans or protocol would you suggest if my CA2729 has been 43 for the past year, tested twice, yet my CA15-3, which are 2 breast tumor markers, by the way, has been in the 30s and gone down to 23 recently. So the person lives in PA. The new DO onco wants to do a CAT scan with contrast, but I don't want the radiation or contrast. My thermogram looks good, began dim, liposomal glutathione last 6 months. Last year when it increased from 33, I was doing heavy duty mold detox, but that ended about 6 months ago. The cancer was stage 2 IDC or PR positive, HR2 negative 7 years ago. If there's a protocol you suggest to address that one marker, I'd love to know. Thanks for the help.
Well, there's not
The
like
4 pillars.
yeah, the 4 pillars for sure. I don't think there's like one protocol for that.
Right.
I mean, when we talk about surveillance, and we're talking about a tumor marker, breast tumor marker that's kind of bouncing around a little bit. Is there some activity? That's the big question, right? Is there some activity somewhere of that breast cancer returning? So in contrast to a CT scan with contrast, I like the PET CTs. Although you can't really pick up tumors that are like less than a centimeter or so. I think it's better it gives us more information. So if you're going to do a CT, I would do a PET CT because it uses the 5DG dye, and it's a sugar dye basically. So it will go to tumors that are metabolically active. So let's just say there was a small mass somewhere that they detected, let's say in your axilla, and a regular CT will say, okay, there's a 2 centimeter nodule there, but it won't let us know, well, is it metabolically active or is it just there? Is it just like a dying tumor or something that we don't need to worry about? And that's why I like PET CTs better. And the way we detox from that is because it is like a sugar contrast dye. We have you come back the next day to get a high dose vitamin C, and that because they have similar like biochemical structures, it displaces much of the dye, and that's how we deal with that. So I would say that would the mold detox cause your numbers to go up? Probably not. So I would just do some surveillance, maybe consider a PET CT scan, maybe do other tests like PHI or nagalase.
Right. Some of the other, even like we talked about earlier, some of those individualized tests, right?
Yeah.
Even, gosh, the QT imaging now, that's something that's a good tool. Just kind of
check
layer
your
it.
hormones, because you were ERPR positive, so I would check your female hormones and see where they're at. The one that I was mentioning earlier.
You
That's
definitely
how
want
I
to
would
make
do
sure
that,
you're doing a lot of surveillance with some of the other tools that you have in the toolbox for sure. So good. Okay, good one. All right, prostate cancer, how long does it take? Kind of a loaded question, right?
I'll let you answer that one.
Yeah, I mean there are a lot of different, when you say prostate cancer, there's different
stages.
Yes.
Yeah.
There's different the pathophysiology. There's just different things to answer this, but I will tell you that if you look at the 4 pillars, and I always go back to that, it depends on how aggressive it is, how bad things are, right?
Right.
As to what a doctor might recommend. And if you're thinking of, let's start with pillar 2. Pillar 2 would be that kill phase, right? There's surgery for these things. There's proton therapies. There's some things that are less aggressive and more aggressive. And I think, without answering this just straightforward, I think it depends on what all the data shows as to what,
absolutely.
say, Dr. Gama, for example, and correct me if I'm wrong, would say, hey, look, these are your options, right? And in the conventional model, a lot of times they'll say, well, we could cut it out. And I know from experience here, because prostate's probably the number 2 that we see, right? Breast is number 1. A lot of the men don't want to take the risks associated with that, right? So then I have 2 gentlemen right now going through proton therapy down in San Diego. And that, based on other patients that have done it, they've done fairly well, right? So again, if you're looking at that pillar 2, sometimes there's a little bit of a bomb, then there's an atomic bomb. When you're talking about heavy duty chemo and say, surgery, that's kind of a heavy bomb.
Right.
But you can use maybe a lesser bomb,
Mm-hmm.
right? But think about this concept. That's still only one chapter of a 10-chapter book.
This
Now
is true.
we look at the terrain.
Yes.
And you start looking at pillar 3, or even let's go back to pillar 2, the star phase.
Mm-hmm.
You start starving it, right, with the right medications based on testing. Maybe a ketogenic diet, and then you get into, making sure there's immune boosting, because a low immune system is always going to be a part of it, right?
Yeah.
Now we test for that. We could do a lymphocyte map test, or we could do natural killer cell CD3, CD57. We could get into all that. And start testing the immune system, but certainly treating that. Oxygen is critical, I think, in my personal opinion. Getting into, charging the cell and getting into the cellular environment as far as, your vitamins and minerals, so forth. But I'll tell you, what's your thought on, from a cause standpoint, right? What I've seen, or what I've read a lot too, that prostate's very dense,
Mm-hmm.
right? There is some evidence out there that whether it's infectious or it's things trapped, like heavy metals or toxins could be trapped in there. There could be something that's promoting an inflammatory response.
Yeah, absolutely.
That is then creating the inflammation that creates the damage. And so
Chronically.
chronically.
Was there like a chronic prostatitis?
Exactly.
That was there.
Exactly.
And similarly with breast cancer, I kind of believe that too, just from a pathologic standpoint. I mean, I looked at slides from someone for a couple years that were sending me like prostate slides to market for fungal elements, and I would say probably maybe 50% of those cases had fungal elements in it.
Mm-hmm.
Was there bacteria in it? I didn't stain it for that, but probably so.
Mm-hmm.
So I think that's important too. That's just, when we're looking at prostate slides for cancer, we see the cancer and it's like, okay, it's this cancer, so that everything else in the background kind of gets overlooked, if you will.
Right.
And those aren't addressed. And so we try to address that underlying possible cause too.
Yeah. Yeah, and you get into like Dr. Gama mentioned before, some of the metabolic. You get into blood sugar, you get into hormones, you get into stress, you get into EMFs nowadays. You get into that list is long.
Yeah.
But I will tell you, a lot of the evidence, in my opinion, points towards some inflammatory type
Mm-hmm.
of pathogens maybe, or metals or toxins that get trapped down there. So and the how long does it take, it really depends on where things are, and then what we're actually doing, and so forth,
and how much we have to reverse, basically.
That's exactly right. Yeah,
Mm-hmm.
there are some, and I'll mention just as a caveat, there are some men that don't want to go through any of the conventional treatments, and they want to handle it naturally. And there is, if it's contained, right, and this is what I've seen, I'll give you my opinion, Dr. Gama can follow. If it's contained and somewhat small, you can press on that. And there's a lot of gentlemen walking around the clinic that have had prostate cancer for years. And they're doing well because they're doing things to kind of keep it at bay.
Yeah, and like you said earlier, like what are some things that might be causing that cell to not be able to, get back to normal? If there's already cancer there, are there things we can do to, like infections, for instance, that we
Right.
mentioned? Like if we were to treat that with some antifungals and maybe doxy, because we use that as
antibacterial.
Antibacterial, but also as off-label use. I'll often put people on doxy for a while, and antifungals. So things like that, looking at other sort of viruses as well to treat that, and I think the survival is a lot longer.
For sure.
Yeah.
With the, not to be redundant, but
Mm-hmm.
with the 4-pillar approach, just doing each of those pillars somewhat thoroughly is going to do the trick for a lot of people. We're going to win a lot of battles that way.
Yeah.
Nothing's
You're
ever a
not gonna lose for
guarantee,
sure.
right? Nothing's ever a guarantee, but it certainly puts the odds in your favor significantly more. Hopefully that helped. Okay, organic produce isn't available. Most effective way, I mean, I personally use white vinegar. I'll just take some white vinegar, maybe a teaspoon or two, put it in a bowl of water, and just let it sit. That tends to work well. Baking soda tends to work well. Very similar approach, but that tends to help quite a bit.
Yeah, I know there's like ultrasonic cleaners that you can buy, that are helpful. I know they're kind of popular right now. And there's other just sort of organic sort of cleaners you can like buy on Amazon to help with that too.
Yeah, true.
So I don't know like of the most effective way. It's just kind of like a personal thing, honestly. Like if you look at studies on like how much does vinegar work or baking soda, I mean you can find those kind of studies online to see how much of the different kinds of pesticides that we're trying to clean off, how each one sort of works. But I think the ultrasonic cleaners work pretty well
They do.
in removing like a lot of them.
They do.
Yeah.
Yep. Okay. All right. So good natural alternatives to brain fog, insomnia, hair loss, osteoporosis. That's a loaded one. I read this one this morning and I went, oh my goodness. I'll just say when I read this, you know, I thought, okay, there's a lot. There could be potentially a lot going on, especially with the endocrine system, hormones, thyroid, adrenals, right, blood sugar, to name a few.
Right.
But that's probably the four areas, right, in that, and even with the brain fog, I don't know. This definitely could be all hormonal.
Could be.
Right.
For sure.
But you could be dealing with some infectious, right, autoimmune type of things. The brain fog leads me to believe there might be some inflammation. Right,
or and treatment, like somebody that's just gone through treatment because we don't know.
Good point.
If they had been gone, you know, there could be a number of factors that finding that sort of root cause first. Because you're right, you can kind of lump them into different groups, right?
You definitely can. Each one of those can have 4 or 5 different reasons, right?
Yeah.
So this is where, if a patient came in, we would definitely start with, you know, the endocrine system. We would start with the immune system. We would look at as many things as we can out of the gate from a cause standpoint, right? I mean, my goodness, your gut health could be a big part of some of this. You know, anything that could create inflammation, driving those driving forces that we mentioned in the cause part, right? Could be infectious. It could be hormonal. It could be heavy metals, it could be toxins, it could be mineral deficiencies.
Yeah, a lot of Lyme disease.
Lyme, the Lyme's a biggie. Yeah.
So I think like, you know, as far as like kind of just like supplements in general, like insomnia, there's a whole bunch of them that you can try. You know, lemon balm is really good. People like that one a lot.
Yeah.
For brain fog, there's so many different, depending on when the brain fog started. Like you said, is it hormonal?
Yeah.
Hair loss. There's ashwagandha, Nutrafol.
Silica drops is a really good one.
And for osteoporosis, you know, that one I'd like to see like you know, how much osteoporosis is there. Strontium is a good one, a good sort of mineral to add with sort of like anything else you're doing. I like the Algae-Cal supplement with the strontium. That seems to work well for osteoporosis. So those are just a few of my favorites.
Yeah, and then your insomnia, just to touch on it, because sleep is so important, there's a cause for that, right? So always remember, things that we might be recommending, my opinion, they're just some Band-Aids, which is okay. We want to use them, but we also want to get into the causes. So insomnia, like GABA-L-theanine works well. Magnesium threonate works well. There's a product called Cortisol Manager from Integrative Therapeutics.
Yeah, I like that one. That's a good one.
Yeah, it knocks down, it has phosphatidylserine, plus your adaptogens for what they call that hypothalamic pituitary axis. That works well.
Yeah. And on that note, just kind of like what you just said, like, you know, is it your adrenals? Like, are you releasing too much cortisol at night? And that's why you're, you know, wide awake at night. So really trying to find the reason why is just better than kind of like you said, using the Band-Aid approach and trying to, you know, figure out what's going on.
There was, when I first started functional medicine, this is years ago, one of the doctors said, the pill book in medicine and the herb book in natural medicine is written similarly.
Yeah.
If you have this symptom, take this. So really, the pill book, right, the only difference is, okay, instead of a pill, you're doing more natural, but it's still kind of Band-Aiding. So to Dr. Gama's point, we would want to look at, okay, why is this happening? Fix it, and then maybe just use some of these supplements for maintenance as far as anti-inflammatories, you know, like Dr. Gama was saying, for clearing out estrogens if we needed, some DIMS, and, you know, just to balance everything out, but low levels. There's the tortoise and the hare approach, I call it, you know, getting to a point where it's the tortoise. It's slow and steady, and you're working on things. So I hope that helped a little bit, but definitely get with somebody who knows what they're doing so they can kind of get to the bottom of that. So farm animals resistant to anti-parasitic meds. is this possible with humans too? Should we use a para 1 or more natural compound so this doesn't happen? Interesting thought. I think I honestly didn't know the farm animals were, but I could see it because they probably use it a lot, right? I don't think humans use it a ton.
Yeah, that's a good point.
So I don't know that I would be too worried about it. Matter of fact, I'll give you an opinion. I don't think we use antiparasitics enough. That's opinion.
I agree.
Right?
Yeah, I do think so. I think that, like farm animals get it once or twice a year, right?
Yep.
So they're getting the same medication. It's usually ivermectin, and what else do they use for farm animals?
I know Fenben is one of them, right?
Fenben.
The fenbendazole,
So
the ivermectins.
That's kind of their go-to, like where ours it's antibiotics of different flavors. So I think that's why we get antibiotic resistant a lot, because some people take a lot of them. Anytime they feel a little tickle in their throat, they're getting antibiotics. But I do think you're right. It's probably less so frequent in humans. Using other things like more natural compounds is kind of good, I think, for just like maintenance.
Ongoing.
Yeah.
Agree.
And then, when you need to use an antiparasitic, then, I think that would be fine.
Yeah, I think my experience over the years, 20 plus, trying to use some natural remedies for parasites has proven, for me, difficult. So I've kind of come to the conclusion, Candida, a heavy load of Candida, a heavy load of parasites, I really think the meds, and even going into the meds as far as a concoction of meds, because there's the larvae stage of parasites, there's the nervous system, if you start reading about it, you're like, okay, this needs kind of maybe a trifecta sometimes.
Yeah, because it's not just like, for instance, ivermectin. I mean, ivermectin is good for some worms, like, tapeworms. It's good for roundworms, whipworms. But then you have other things like liver flukes and, other parasites that it's not going to be good for. So just like different antibiotics are useful for different bacteria, there's different treatments also, antifungals, antiparasitics, different ones that are useful for the different kinds that we sometimes find. Yeah,
agree. So so the para ones and such that Dr. Gama was talking about, or that you mentioned, I think are great.
Yeah,
right? I wouldn't have a problem with those, and I don't know that it's a bad idea, to either get on something like that every 6 months, I just think we're exposed to parasites more than we think. And I think they're a bigger problem in our health, especially here, what we see. I think they're a bigger problem, in general.
Think there is,
I believe that. That's my personal opinion. So yeah, you can use them, but there's other things. All right, radiation for breast cancer. I can tell you, we talked about this a little bit. There are, let's see, I'll give you exactly what she recommends. Sauna for sure, right? So the sauna is definitely a part of it. She really likes something called C60. It's an olive oil based kind of detox supplement or liquid. And then she likes superoxide dismutase. That's a really good one along the methylation process that Dr. Gama was talking about. That SOD is really good for just clearing out toxins. And then, or with, the side effects of radiation. They're the big three that I know Keneally talks about heavily. Do you have any other that you like in your repertoire?
Well, so that's like, she's recommending radiation?
Oh, what does Dr. Keneally recommend radiation? Oh, why? Oh my gosh. I read that totally wrong. I thought, what was the recommended to protect? Sorry.
Okay.
So why does Dr. Keneally recommend radiation for breast cancer? Well, I'll tell you, here's what I hear her saying quite a bit. When you're talking about big picture, and we're trying to get up the speed on things. So hypothetically, say somebody comes in, I'll use triple negative, with a high Ki-67 score. Which Ki-67 score means it's the cell proliferation rate, right?
Mutation, yeah.
So when something like that happens and we really haven't seen the patient, and potentially the patient comes in and they're asking us, okay, what should we do? I know, and I get this mentality. Keneally's like, look, we may have to throw some things at it until we get the terrain right, until we get things stable, until we get X, Y, or Z done. And so sometimes, whether it's chemo or radiation or something like that, really is a means to an end at the time.
Right, because it's not that we just believe in only one form of treatment
Exactly.
or another. It's kind of, it's really, it's kind of like a continuum or a spectrum, if you will.
Correct.
So it's kind of what's going to be best treatment for you, and that could include radiation and chemotherapy and whatever else your oncologist is ordering for you.
And we love to avoid it, right? Of course. My slogan, if you will, is we're definitely conservative, but we're not naive.
Right.
Right? We want to make sure collectively that we're looking at data for each individual. We're seeing what the data points are. You know, if you think about before any testing's done or we look at anything, there's almost like a clean canvas.
Yeah.
When you start getting this data, that canvas gets filled in. And then it could either be like, ooh, or oh.
Yeah, I know one of the things that I sort of use for that is I'll look at genes. So if somebody has a CHEK2 gene, for instance, if you have the CHEK2 gene and you get radiation, it could predispose you to like secondary cancers down the road.
Right.
So those are things that I kind of dig for and look for. And if somebody's like coming in saying that, well, you know, my oncologist wants to do radiation and I don't really think it's a good idea, I don't really want to do it, then we'll get the information. And so I'm here to kind of guide you to say, okay, well, you don't have the CHEK2 gene, so I think it would be okay for you to get radiation if that's the way they want you to, you know, that's the route to go. So those are things that we look at too, from a genetic standpoint as well. That might be helpful in making that decision.
It's a great point. And there could be other data points that are collected, meaning if say somebody, say a lumpectomy's done, clear margins, everything's clean, their standard of protocol is radiation because they don't want to leave any of those cells behind. Well, we could maybe possibly, right, don't just hear me out, do additional testing like the Fulgent and the DATAR and RGCC or something like that, and all the other testing to back up the fact that, hey, we think they did get everything. So if everything comes out clean, right, maybe that's a decision the patient could make with their oncologist, right? Hey, everything's clean. And again, remember, one is just standard of care, one is taking maybe an additional data points to see if that's a recommended. Is that fair to say? Is that, I mean,
yeah, I think so. I mean, I think, you know,
I'm not advising it, by the way.
Yeah, we always want to be like cautious, and since we can't know with 100% certainty if there's a cancer cell or cells out there. And so I think, you know, from an oncologic standpoint, you want to be sure that you don't want to have regrets later.
Yeah, exactly.
That's really kind of the bottom line. So
100%.
You don't want to do too much, but then you don't want to have regrets either. So, you know, kind of listening to the care, the plan of care that's outlined, and, you know, intuitively, does that mesh with you? And, you know, is that something that you think you want to do or need?
That's right. And it's meeting the patient where they are.
Yeah.
I had a family member, I'll touch on this briefly, that had lumpectomy, clear margins. They recommended radiation after 3 weeks, targeted radiation. And so the question came up, well, based on your stats, how much does that increase healing or chances of, you know, they give the 5-year survival rate? So it went from like 85 to 95%. Well, that's not bad.
Yeah.
You know, so this person, family member, because we had the stuff that could help reduce the negative effects, decided that was good for her and her psychology, right? So it's just, I think, to each their own, but that's why Dr. Keeley may recommend it at times. There's a lot of variables to that. All right, mitigate harmful effects from certain imaging like CT scans. Kind of the same what I just talked about, so I was ahead of myself, is the SOD, the saunas, your C60s, you know, even your castor oil pulling, your lymph drainage, you know, all these different detox/drain, Epsom salt baths.
Yeah, glutathione. You could do the Oxycell, which is like glutathione cream.
Yep, it has a little SOD in it too, which is a great one.
The polyphenols like resveratrol, you know, quercetin, if you can take that. The baths, a clay bath, a magnetic clay bath, chlorella, spirulina.
Binders, good binders,
things like that would be helpful.
Yeah, all those things collectively very, very good. And that's what we recommend too. All right, strong pain, right ovary, right around ovulation. Now that my cycles are getting irregular, I have occasional burning in my right ovary. Is it common? If you recommend getting it checked out, what type of scan would you recommend?
So if you're in like, if you're in childbearing years, we'll say, That could be, it's actually, there's a name to that when you have pain in your ovary around ovulation. It's called Mittelschmerz. It's a German name, and it's basically means you're ovulating. And some women get it and some don't. Now, why it's only on your right side, I'm not sure. Maybe there's a cyst on that ovary. I would say that if your cycles are getting irregular, that you probably need to get an ultrasound first. So you can do like a pelvic vaginal ultrasound first, as they can kind of take a look and see if there's anything going on with that ovary, like a cyst.
Right.
That would be the first thing. But yeah, I would definitely get it checked out.
Yeah, for sure. Yeah, ultrasound, you get your hormones checked. I think I think you like the HUMAP, Dutch test, physician's lab, something like that. Get the hormones, but the ultrasound I think would be a great first step too. So, and then you could get into some of these additional lab markers that we talked about too. So, last question. It's almost. Dr. Gama has a hard stop at 6, so we'll do one more. Okay. Stage 4 breast cancer, HER2 positive, mets my bones. February 23, currently no active cancer, PET 6 months, wondering your view on continuing to get Phesgo, trying to go as natural as possible, conflicted if I really want Phesgo anymore. Do you recommend Phesgo in general for HR2 positive? It's a lot.
Yeah, I mean, I would say that, it would be nice to see like your whole history first before I really comment on that, because I wouldn't want to like sway you in the wrong direction. Right. For sure. But congratulations on being, cancer free for 6 months. So I wouldn't recommend getting off of any like immunotherapy drugs or anything, because there's a reason why it's negative, and it might be because of that. So I wouldn't recommend that you get off of that. If you were to try that, definitely do it in a like more controlled manner, like checking to see if you have those methylation detox genes. Are you building up enough of it? Do you maybe need to take it every other day instead of every, that sort of thing. So there's kind of a lot of factors that go into play for that, but I think that eventually you could, I don't know how long they told you to stay on that for, but I think eventually you could consider getting off it, but I'm not sure that I would do that right now.
Yeah, and I would add to that, if the way you possibly could need that less is to follow a kind of the 4 pillars, right? Is really make sure the surveillance is doing well. Make sure you're supporting the cell with your immune boosters, oxygen, charging the cell. Cellular, health is really, really good with your vitamins and minerals. And then making sure you're working through these causes. That's an example of what I hear Keneally say, and you said it too. Hey, before you do anything like that, you want the terrain changed. You want to make sure you've worked on things that have been tested, treated, retested, gone, and there's cleanliness everywhere. Then there's a possibility, in my opinion, that could be an option.
Yeah.
Fair? Is that fair to say?
Yeah, that's fair.
Yeah. So, okay. All right.
We do one more, maybe.
You sure? Okay. All right. So, this is an interesting one. COVID vaccine, how are they responding to natural treatments? So, we do see a lot, right? And again, one of the things that I'll say, and we did it 2 weeks ago, the EBU does a really good job.
Yeah, the EBU's great.
Yeah, it's really, really good. And I don't know, I know the vaccine, right, there's that, but I think COVID does a number on people too, personally, right? I told you my story, but I can tell you the EBU has worked well for both COVID patients and the vaccine.
Yes.
Not solely, there's other things that could be done, but yeah, the ozone and the EBU does a wonderful job of kind of clearing out the junk. And then detoxing too. Doing a lot of detox. So, did you have anything to add? That was pretty good, right?
Yeah, that was good.
Pretty solid.
I think that was good.
Okay, all right. Let me just we'll get to these. We'll put these on their next Q&A in 4 weeks, right? So, I just want to give you an idea here. So the center, Cancer Center for Healing, Vicki does a really good job down there of just answering questions and processing new patients. 949-581-4673 or 581-HOPE. You have at the bottom here, just want to show you, if you're looking for prevention, maybe prevention of reoccurrence that you had cancer years and years ago, and you're looking for a wellness type of approach that we talked about, that 949-680-1880 number is a biggie,
Yeah,
right?
because we can just, like, honestly, just getting started with just a wellness plan, and, not necessarily you even have to have cancer, but
Right.
like you said, prevention, and just, these are labs that, the specialty labs are labs that are great for everyone to just be healthy with everything that's been going on in our world.
Yeah, and
So-
doing a preventative or
Mhm.
early detection once a year investment. There's
Yeah.
so many things now, so many labs, tests,
Gut health,
yeah.
immune health,
All of it.
Yeah.
all of it. So, and we promote that heavily, not just clinic-wise, because we do, but in general. Find a good functional medicine practitioner that can take you through these tests and start looking at things. Because again, if they're there, it's inflammation leading to oxidative stress, and that's a big word, right? Oxidative stress, which damages the cell. If it's damaged long enough, it's going to change, and then mutations will occur, and then so clean up the cell and get rid of the causes, and that's a good 1-2 punch. Okay, all right, everybody. Dr. Gama, thank you.
Okay, yes, thank you,
Excellent.
everyone.
Appreciate you. All right, have a great week, everybody.